Good evening and welcome to another Government of Jersey Facebook live event. We are here once again in St Helier tonight to discuss the winter vaccination programme. That is what we would all usually associate with our flu jab, going to the GP and getting our flu protection for the winter, but also this year there's that added extra of the need for us all to have the COVID booster jab, or for those in our community that need it the most. We have got a panel of experts alongside us tonight who are going to answer your questions. Your questions have been coming in thick and fast throughout over the bank holiday weekend and also today. I'll come on to those in a moment and also explain how you can get involved with any further questions that you might have this evening. First of all, what I want to do is just introduce who we've got sitting alongside me tonight. Some familiar faces indeed. We've got Becky Sherrington, who is the head of the COVID-19 vaccination programme. We've got Dr. Ivan Muscat, who is the Deputy Medical Officer of Health and the face of how the island has dealt with the COVID pandemic, and Ross Barnes, who is the operational lead for the vaccination programme. So good evening to you all, and we will be with you very, very shortly. So just some initial housekeeping rules. If you want to get involved tonight, it's really, really easy. All you need to do is on your phone, your laptop, your computer, whatever it might be, go onto a website called slido.com, S-L-I-D-O, slido.com. You don't need to download anything. You don't need to enter your name or any personal details whatsoever. All you need to do is enter the hashtag or the code for tonight's event, which is the same as the COVID helpline, 445556. If you enter those numbers, you will then see all of the questions coming in. You can have a look if your question's already been submitted, and it'll be in the queue. You can always like that to push it up the list slightly, and if not, enter your own. As you can see from those that are in there, you don't even need to put your name on them. It's been, since we were last here, it's been quite a 10 months since we started the vaccination programme, and we first put your questions to this panel of experts. Something like 85% of the adult population in Jersey has now had both of their vaccines, an absolutely remarkable statistic and achievement. And that programme continues now to get us through the winter ahead. What I'd like to do, first of all, if possible, Becky, is just ask you to maybe have a bit of a recap of those 10 months and also explain a bit more about what's coming up in the winter vaccination programme.
Yeah, it's been a strange but interesting 10 months. But I can just like to say thank you to Islanders, because they've really supported us as a team as well as the programme. We were going into the winter periods last year. We were entering another wave, so we were heading into some really choppy waters, and we had no vaccination available to us. So we were in a really challenging position, and people were obviously really quite worried. We then got to the point in December when the vaccines arrived on the island, and we began vaccinating in mid-December. So just between the period of mid-December to now, we've vaccinated 98% of all over 50-year-olds have received double vaccination, which is incredible. And that has put us in an incredibly strong position as an island, which is really important. We don't have the availability of alternative health and social care. So we needed to make sure that our island was well protected. And just in those 9 months, we're now at that point in which we have really good levels of protection. So that's been a real success. But my view is that I think part of that success is us being open and transparent and working with Islanders. We couldn't do this alone. It needed to be working with the Islanders, and we've done that. So I think now, going into the point where that immediate risk of hospitalisation and death is no longer as apparent, it's really important that perhaps we discuss, why do people still need to be vaccinated? I think that's a really important question. Yeah. And I think that if people are going to be coming forward for boosters, they need to be really aware of why that's important so they can make an informed decision. So we just thought that actually tonight was the opportunity to talk about vaccination, open and honestly, and allow people to ask those important questions.
Absolutely. I mean, and there's also, there's a lot of facts out there. There's also a lot of fiction. It's important for people to understand and get the information they need to help them make the decisions that's right for them and their loved ones. I mean, Dr. Muscat, just touching on what Becky was saying there about working together as an island, I should also just congratulate you for picking up the Inspirational Leader of the Year award at last week's Pride of Jersey Awards. I was fortunate enough to be there, and whilst accepting your award, you made it absolutely clear about the importance and the need for teamwork. And from an island perspective, what did you mean by that?
Precisely that it is not up to one individual or a few individuals. This is a collective effort, and we must work together to get there together. We must therefore communicate bilaterally. We need to understand what people are worried about, what they're thinking about, and they need to understand what we're thinking, so that we are in fact joined together in our endeavour to bring COVID to turn it into something which is livable with on a day-to-day basis.
Great. Well, that's, hats off to that. Absolutely. That's all what we all want to see. Right. Well, look, we've got approximately 90 minutes tonight. So I want to get through as many questions as we can from the members of the public who've taken the effort and made the effort to submit those questions. What I should say is there's a lot of questions have been coming in asking, rightly so, about the vaccination programme for children and for young people in the island, and schools, and how all that's going to work. There have been that many that there actually now has been a decision that we're going to have another one of these events in the next couple of weeks dedicated purely to that. It doesn't mean we can't cover it tonight, but it means we're not going to let it dominate this, because there's a portion of the community who really want to hear about the winter vaccination programme. So if we don't get around to some of those questions, don't worry, they will all be carried forward to the next event, which, as I say, will be in the next couple of weeks, and we will hopefully be able to address any concerns or questions people have around the vaccination programme for young islanders. So let's get straight on to the first question that has got also the most likes here as well. And this one might be for you, Dr. Muscat. Norway has just reclassified COVID and is treating it as the same level of threat as flu due to statistical data. Why aren't we doing the same?
We are all travelling in that direction, and it's a question of when to actually say that COVID has diminished from a pandemic type of threat to an endemic type of threat. The mortality from flu on an annual basis is about 1 per 1,000, and the mortality in the third wave following vaccination in Jersey had dropped to about 1 in 1,000 cases as well. So there is the start of an equivalence there. We're not quite equivalent on all levels. The infection rates may continue to be high. We do not have antiviral agents active against COVID in the same way as we do with influenza, but we are edging closer towards COVID being a more manageable problem. We hope that towards the end of this year we will have oral agents active against COVID, which will bring us more on par with where we are with influenza. The WHO, the European Union and the UK continue to perceive COVID as a pandemic, and that of course is quite different to thinking of it as flu, but we are getting closer to that point.
But as an actual illness that islanders may catch this winter, on a par, how does flu compare to COVID as a threat?
Well, firstly, it's important to stress that all the studies that have been going on during the period of vaccination against COVID have shown very categorically that immunity to COVID wanes with time. And that's particularly evident in people over the age of 50 and in those at risk. And therefore, on that basis, it is important that those individuals are given a COVID booster going into winter, and that program has started already. And I urge people to ensure that they take up the offer for a booster as long as it's, of course, more than 6 months after their second dose.
Okay.
We do not know whether such boosters will be required on a regular basis going forward. That is being studied as we speak. This whole COVID experience is an iterative experience. We're learning on a day-by-day basis about it. We've never seen it before. Additionally, this coming winter, we expect to see more respiratory viruses doing the rounds because lockdown last season prevented those viruses doing the rounds, and therefore prevented people from boosting their immunity to influenza, to RSV, and to similar viruses. So it is particularly important that in addition to taking up the COVID booster, that people take up the offer of a flu vaccine, which this year has been expanded, as it was last year, to people down to the age of 50, as well as those at risk under the age of 50.
And what about the wider population under the age of 50? Is there any plans to roll it out beyond there?
If they are at risk, then they will be offered vaccination. If they are not at risk, then there is no plan to roll it out under the age of 50. This is the same as in the UK, by the way.
Okay. And Becky, I suppose leading on from that, somebody here has said that since they had the vaccine, they've had health issues themselves, so they believe that are linked back to that vaccine, and they don't particularly want a booster. Do they have to have it?
No, so none of the vaccines are mandatory. We do recommend vaccination. So if they've had the first dose, we know that the second dose is really important. But if they're concerned, they can either talk to their GP or they can talk to one of the GPs at the vaccination centre too. So they can come and talk to the vaccination team or, as I say, in primary care around what they should be doing for their second. Or if it's around the booster, again, similarly, they could talk to one of the GPs on site before they receive the vaccination.
Okay. And so, I mean, Ross, I'm sure that we will find a technical question in here very shortly. I'm just trying to get through some of these, some of them that come to the top of the pile, which naturally are focusing on the health issues. Dr. Muscat, again here, somebody's asking, if you are vaccinated, can you still catch COVID? Can you still pass it on?
Yes, is the answer. But the risk of catching Delta, which is the current prevalent and highly transmissible strain, with the Pfizer and Moderna vaccinations, and indeed the AstraZeneca, is significantly reduced because of the vaccine efficacy. So the vaccine efficacy is approximately 80% against catching the infection. But if you do catch the infection, then the severity of the illness is much less. The risk of hospitalization is much less, but you can still transmit the infection onwards. If you've not been vaccinated at all, then of course you don't have that 80% protection against catching infection. You've got none at all. So you've got 100% risk of catching the infection and of transmitting it. So being vaccinated, although not providing complete impermeability to the virus, does provide significant protection against catching the infection, against getting severe disease due to the infection, and against transmission. So you're far better off with the vaccine than without the vaccine.
Right. Thank you. So Ross, just to clarify this then for people, we've got at the moment we're going to have 2 vaccinations offered to islanders of those over 50 or those under 50 who are vulnerable. What's going to be the process? How are they going to find out? Where are they going to go for those? Is it all in one space? Is it a mixture of GPs in the hospital? Tell us what's going to happen.
Sure, yeah. So we've been always trying to make the vaccine so far as easy and accessible for people as possible. There are a number of constraints with handling the COVID vaccines, as we know. So we've gone with the model of having a centralised programme that delivers that in the mass vaccine centre, and with some mobile units that have extra control measures in place. With the flu, that's slightly easier. So we've been working with the primary care body and local pharmacies to be able to work out the best method of delivering the flu vaccine for this winter period. And we've gone with a blended approach. So whilst COVID will all be delivered still within the vaccine programme at the vaccine centre and through our mobile units, flu will predominantly be provided in the traditional method through GP surgeries and pharmacies, but also with the option to co-administer at the vaccine centre when you receive your COVID booster. And that'll simply work as you book into your COVID booster. When you arrive at the vaccination centre, if you haven't already made your own arrangements to receive your flu, you'll be offered it there and then to be co-administered for you at the time.
So you could go, theoretically you could be up at the fort, you could have been, would you be contacted to go up for your COVID booster? You're then there and you'll be asked, have you already booked in for a flu jab? If not, do you want it now whilst you're here?
So we won't be reaching out to people this time. We've made some really good digital improvements in our booking system, and also the constraints of the administration, particularly for the booster, have less constraints than it was for the second dose. So this time we're giving the freedom back to the public to choose their appointment time and opt in to have their booster. So via our online portal, you can book either your first, second or third dose for your booster, or if you're unable to use that online system, you can go through the helpline to book the appointment for you. So you book your booster appointment, and then, as you say, when you arrive, if you haven't already made the arrangements for your flu, then we'll be able to offer it to you there at the time as well.
Fine. And Dr. Muscat, somebody mentioned this to me the other day. When they, I think it happens to quite a few people, when you have your flu jab, sometimes you feel a bit rougher for a few days afterwards. And obviously there were some people that felt ill after having the COVID jab and some people that didn't have any side effects. Is there a possibility if they do have both jabs on the same day, they might get sort of a double dose of feeling ill? Should they space them out? Should they try and have them on the same day? Any advice?
I think the advice is to make sure you get both vaccines, and therefore, if you feel that you can only fit both in at the same time, just go ahead and get them at the same time. They have been studying the co-administration of the two vaccines in order to actually determine if it's appropriate to recommend to people that they can have the vaccines at the same time, and it is. It is true that sometimes people feel a bit under the weather after vaccination, lasting a day or two. Hydration and paracetamol will normally see you through that. It is far, far better to have that little hint of feeling off colour than having true flu or COVID.
Indeed. Becky, anything you want to add there about what people can expect when they get up to the fort? Is it going to be very similar to the last time? Is it going to be a bit more smaller scale, do you think, or?
No, because we need to do this as quickly as possible.
Okay.
So, as Ross said, we've gone for a centralised model, and the reason for that is we can do it as quickly as we possibly can. So, we still have a vaccine supply amount that's given to us by the UK, so we need to make sure we have enough appointments that balance that vaccine supply.
Does the booster have to be of the same vaccine that you had, or can it be any?
That's a good question.
Okay.
The recommendation, so there's been studies over the last few months that have looked at which vaccine gives you the best immune boost. So those studies have concluded and have been reviewed by the JCVI, and it should be an mRNA vaccine.
So what does that mean?
So that should be a Pfizer vaccine.
Okay.
So regardless of whether you had AZ or Pfizer last time, the recommendation is Pfizer gives you the best boost. So we are offering Pfizer. There may be a small amount of people who can't receive Pfizer, and in which case we'll give AZ. So it's about making sure you have that discussion with the vaccination team when you arrive, but predominantly we'll be using Pfizer for the booster vaccine, and that's based on the studies that have been done and recommended by JCVI.
And you've also got some, and you said you've got plenty available and in stock as well.
So the vaccine supply is given to us by the UK.
Yep.
it doesn't feel as if that the vaccine supply is quite so bumpy as it has been over the last few months, but the vaccine is still limited. So we cannot do it all in 1 week. We need to make sure that the vaccine appointments equate to the vaccine supply that we have. So we are opening up to appointments as soon as we possibly can. So as soon as you can get your COVID booster, we recommend that you book in. And perhaps Ross can give those dates around the different ones. So we're recommending as soon as those dates come up, you book in as soon as possible, because that vaccine supply is limited, and we'll then move on to the next cohort. The other point is as well is don't delay getting either your booster or your flu vaccine. We will be offering both, but what I would say is that it's really important that you do get both this year. We need to be in a really good position that we're protected against future COVID waves as well as flu. So if you've got the offer to have your flu vaccine, get that as soon as you can, even if your booster hasn't, appointments haven't opened up yet.
So that's a good point there. So it's possible that your GP might write to you, or your employer or your pharmacist or whatever, as you normally have had your flu jab. You should go ahead and get that anyway, and then wait for your moment to go up to the fort.
So if the stars align, that you're sat on the chair at the vaccination centre having your booster, we will offer you the flu vaccine. But what I would say, is go and get your flu vaccine or your booster as soon as you possibly get the offer of either of those.
Fine. And Ross, what's the time scale? When would you like to sort of see islanders boosted and vaccinated against flu?
So as Becky said, the supply constraints that really underpinned everything we did for dose 1 and 2 are more relaxed. We have that supply chain has now caught up, particularly with Pfizer, who have now been manufacturing for almost a year, which is great news for us. So we are able to offer those appointments a lot quicker than what we have for the first 2 doses. So we're currently open to all 70 plus as of yesterday for their booster, as well as all healthcare workers, and we're making our way back through the care homes to vaccinate care home residents. And every Monday from now we'll be opening to a new cohort. So from Monday coming to over 60s, the following Monday over 50s, and then the Monday after that the remainder who are eligible, so those who are close with immunosuppressed and adult carers as well. So we're really trying to open to as many cohorts as possible. The key constraint for us at the minute is the 6-month interval. So whilst the vast majority of people will be past that 6-month interval from their second dose by mid-November, and we'll have been able to offer them an appointment, it will continue on into the new year as we continue to get past that 6-month interval for people who have only recently had their second dose. So certainly see by mid-November the vast majority of people will have been offered their booster.
So that's just to be clear, for anybody confused, there needs to be a 6-month gap from having their second COVID jab to having the booster jab.
That's correct. Yeah.
What about flu jab? Does it matter if you're a latecomer to the party and you've only just had your second COVID jab? Can you still go ahead and get the flu jab if you're offered it? Any problems there? Anyone on the panel? No, fine.
Just go ahead.
Go ahead and get that, and then wait for the 6 months. Fine. And what would you like to try and see the majority of islanders maybe even vaccinated and COVID boosted before Christmas, this side of Christmas?
Yeah, absolutely. So with the supply chain that we have in place and the number of appointments we're able to offer, we can certainly offer the vast majority of eligible people by mid-November.
Fine. Right, well, thank you for that. Hopefully that's cleared up things for people at home. They know what they're expecting. Again, if you want to get involved and you want your questions to appear here, I know that you're watching on Facebook, a lot of you. I know it's very easy to post a comment in Facebook and the chat there, or a question, but unfortunately I'm not going to see it unless you go on to Slido. So hop over to slido.com and enter the code 445566. Aim in, ask the question, it will appear on the iPad in front of me, and I can hopefully put it to one of the panel members here, which is what somebody did do yesterday, and their question has had quite a lot of likes here. This is probably for you, Dr. Muscat. How can we justify vaccinating children against the disease when they statistically have 0 chance of dying from it or being seriously ill?
The risk of severe disease and death from COVID in children is much lower than in adults and much lower than in the elderly and those at risk. It is not, however, 0. So the risk of death as seen in the UK, per million children in the second wave was about 0.5 to 2 per million children. The hospitalization rate was about 400 per admissions per million children. The risk of pediatric multisystem inflammation was of the order of about 5 per 10,000 infected children, which carries a mortality of its own. And the risk from having COVID and therefore not attending school and not being part of the usual social network has been considerable. We don't yet have precise numeric data to reflect the effect on their mental health, but we do know that suicide rates amongst children have gone up over the COVID period. And that, together with the long-lasting effect of mental ill health and a significant dent on the well-being of children, is a matter of concern. So, whilst JCVI, in looking at the clinical risk-benefit ratio, felt that the benefit, although outweighing the risk at least 10 to 20-fold, was not considered by them to be sufficient. They acknowledged that that clinical risk-benefit ratio was not the only consideration that needed to be taken into account. They needed the overall well-being of children and the mental health of children and the effect of a disruption of their education to be taken into account. They stated that they were not experts in that area and asked the 4 CMOs of the UK to seek advice from specialists in that area and take their own deliberations and the deliberation from the College of Pediatrics, Psychiatry, GPs, Public Health, and the Academy of the Royal Colleges into account. And that's what the 4 CMOs did, and concluded that 12 to 15-year-olds were better off being vaccinated than not. And that is actually the same conclusion reached in the United States, in Canada, in the European Union, in Israel and other countries. It is the right way forward.
So it's not only that, as you say, that it's not only that medical risk, but the outweighing, looking at the benefits versus the harm, but also from a lifestyle point of view, that disruption, the whole disruption to schools and everything, family life, I suppose, the wider implications.
And how that reflects on the well-being of children. So it must be emphasized that the CMOs only took into account the welfare of 12 to 15-year-olds when coming to their conclusion, when coming to their decision. They did not take into account any benefit to the wider community. It was solely children-based.
Okay. Right, so just changing tack slightly. Becky, what's the plan for those islanders who are shielding at home? How will they get their booster, and how will they maybe get their flu jab?
So that was a really good question that was asked earlier on in the year, and a lot of people who had been shielding, who were at high risk, were really quite worried about coming to the vaccination centre, understandably. And so we made it a really safe space for people, and we continue to do so. So we work really closely with our infection prevention and control team, who do regular audits. And we've made sure that the infection control measures are still in place. So I would still recommend anybody who is still concerned about the risk of COVID to come to the vaccination centre, because we still have all those measures in place. So regular cleaning, deep cleaning, a really good one-way system so you can avoid contact with lots of people. The vaccinators wear masks. Every area, I'm sure you've all seen, is regularly really cleaned as well. So as a nurse,
every seat, in fact, every time
every
somebody
seat,
moves,
yeah. And as a nurse by background, that's kind of one of my real things around making sure that we have really good infection control. And as I say, we've been working with our fabulous infection prevention team, and who've provided us with really good infection control audits and come and do spot checks on us, which are really useful.
And what about those who aren't shielding but might be housebound? They can't, get up to the fort themselves.
So again, we've got to the point where we're now on the 3rd dose of the vaccine. So our team are really well rehearsed in doing mobile visits. So if you are unable to come to the vaccine centre, and what I would say is though, if you are able to get to the vaccine centre, I'd recommend that you do that because it's much quicker for you to come and get your vaccine in that way. But if you aren't and you are housebound, and there is part of the community that are really housebound, then we will be able to vaccinate at your own home. So the team, we've got a list of people that have already received their vaccinations in their home. So we're working through that list at the moment to arrange an appointment to go and see people. If though that you think you aren't on that list and you haven't had a vaccination at home and you now do need one, you're actually housebound, then please call the helpline and we'll add you to that list. But as I say, it's not very quick to do the mobile unit, so I would much recommend that people, if you can, come to the vaccination centre.
Fine. And just for anybody watching, that helpline number is 445566, which is also the code you need to enter to get involved in this evening's discussion on Slido. Another question here, whether this is for you, Dr. Muscat, or you, Ross, what's the thinking behind the 6 months? Why do we need to wait the 6 months before getting the booster?
The studies that have been going on since the vaccines have been rolled out, looking at the real life efficacy of the vaccine with time, has shown that you do get extremely good protection for 6 months after your second dose, but thereafter there is a perceptible decrease in vaccine efficacy. And this is particularly noticeable in those over the age of 50 and those at risk. So vaccinating before 6 months is not really going to be helpful. Vaccinating much after 6 months starts to put you at risk. So starting to vaccinate after 6 months, between 6 months and 9 months, is probably very reasonable. And as long as you get vaccinated in good time for winter, as long as it's after the 6 months, you should be well protected.
Okay. Well, just sticking with you, Dr. Muscat there, another question which everybody seems to be liking here at the moment, which has come to the top of the pile on Slido, is the question posted a day ago from an anonymous person. Ivermectin and hydrochloroquine have been proven very effective in treating severe cases of COVID-19. Why aren't we considering these as treatments here?
Because they are neither safe nor effective, in summary. So hydroxychloroquine has been trialled in Oxford. Oxford have taken a lead in trialling drugs that may be useful in the management of COVID with a view to determining if they can be recommended within the sort of UK health service or not. Hydroxychloroquine was one of the first to be looked at and was considered dangerous and should not be used and has been removed from the list of contenders as a treatment. Ivermectin is newer to this scene and is being trialled. The problem with ivermectin is that the dose you need to give to have an antiviral effect is at least 100 times more than the usual human dose. Ivermectin is used as an antiparasitic agent. Unfortunately, some people have bought ivermectin in the configuration used in animals and have seriously overdosed themselves, and some have died as a result of that. So I would seriously suggest to people not to try to get hold of ivermectin or indeed hydroxychloroquine and to self-medicate themselves, because they can end up in serious trouble.
So that's quite a stark warning there. I mean, I think you touched on this at the beginning, but someone just here said, why, no one seemed to get the flu last year, so why do we need a flu jab this year?
Because we didn't have it last year, is the
answer's in the question.
Is the blunt answer. But we didn't get flu, or indeed many respiratory infections last year because of the mitigation that was put in place to avoid getting COVID. So in the same way as we avoided getting COVID, which is a respiratory virus, of course, because of the mitigation factors we put in place, we didn't get flu or RSV or other viruses. This year, we all hope to maintain reconnection over the winter months. And therefore, if there are any circulating viruses, they will circulate because we will be reconnected as normal. Because we have not been exposed to flu and RSV last year, our usual immunity boost to the immune system that we get on an annual basis has lapsed, and we are therefore more prone to it this time. It is therefore more important than usual to get your flu vaccine this year. You do not want to have a person recovering from flu getting COVID, or the other way around. You want to avoid both if at all possible.
I mean, is it possible to catch both at the same time?
It is, but it is more likely to get them consecutively.
Okay.
And
why? Because your immune system's down because you've been fighting one? Or?
Just because of chance.
Okay.
So if normally, especially if you're at risk, if you get flu or COVID, it takes a long time to recover. It sort of pushes you down and it takes a long time to resurface. If you're in that process of gently recovering from flu or COVID and then you are pushed under again by a second virus, then the chances of a favourable outcome are less. So being vaccinated against both puts you in a far stronger position to avoid both.
Wow. Becky, somebody here has asked, you might be the person for this, if I've had COVID, do I still need to have the booster? Am I not immune from it now?
No, so you will have a degree of immunity, but we are still recommending that you get the vaccine. We know that natural immunity does wane over a period of time, so vaccination gives you that much better booster. So the recommendation is if you've still had COVID, you should receive your vaccination.
I mean, are there any other kinds of natural immunity that people might be talking about that isn't necessarily as good as they might think?
Immunity to some viruses does wane with time. A good example, which we've touched upon during this talk, is RSV. So you can get RSV repeatedly because immunity wanes and is boosted by recurrent exposure. So the recurrent exposure causes less of an illness, but allows you to boost your immunity to RSV. Coronaviruses as a whole, which hitherto have largely caused the common cold, also are associated with a waning immunity, which is one of the reasons why you get recurrent colds. Of course, there are other viruses that cause colds. And we see the same thing with COVID, which is a coronavirus. What's interesting is that the natural immunity caused by COVID infection is really boosted hugely by vaccination, and the sort of the hybrid immunity that you get with natural infection and vaccination is really a wonderful immunity, because it's not only significantly augmented, it is broadened to the extent that you are actually immune to variants of COVID as well. So getting natural infection and a booster is the best place you can be in at the moment.
Right. Okay. Ross, we've just had hundreds, if not thousands, of students all head back to university. What's the thinking or plan for capturing those with a booster jab, so they don't all come back at Christmas and catch COVID or spread it?
Sure. So for that sort of age group, the booster isn't universally recommended, as it's only for over 50s and the at-risk. But those that are within the at-risk group, or indeed health and social care workers, they will be eligible for a booster. So for those that have left the island, we do still have a reciprocal agreement with the UK. So for any one of their doses, including the booster, if they are in the UK and it's their time, they can approach the NHS to receive their vaccine that they require. Failing that, again, once they return to the island and they're eligible, they'll be able to book. We've got lots of appointments available, so we'll make that available for them.
Fine, thank you for clearing that up. Dr. Muscat, I think the one top of the pile here is heading your way. Is there an association of myocarditis or pericarditis following the COVID-19 vaccination?
There is an association between...
Can you just explain what those are, first of all?
Of course, I apologise.
That's right.
Yeah, so myocarditis is an inflammation of the heart. Pericarditis is an inflammation of the outside lining of the heart. They are usually caused by viruses. They can be caused by autoimmune disease and bacterial infection, but they certainly have been associated with the Pfizer and Moderna vaccination. The risk is low. The risk is of the order of 10 to 20 per million doses. For the younger age groups, it's about 10 per million doses. That risk is 10 to 20 times lower than the benefit you get from vaccination in the younger age groups. So the risk-balance ratio is still in favour of vaccination. But very importantly, there is a significant difference between the myocarditis that you get following a viral infection and the myocarditis that you get, if you are going to get it, following Pfizer vaccination. The myocarditis you get following Pfizer vaccination is almost always mild and it clears spontaneously, or with bed rest and simple treatments rather than anything draconian. The myocarditis you get with viral infection, on the other hand, can be quite severe and can require hospitalization and may leave you with long-lasting damage. It is worth saying as well that COVID infection itself, COVID of course is a virus, does cause myocarditis or pericarditis at a rate of between 0.7 and 3%. So the COVID infection in itself causes or can cause myocarditis or myopericarditis. But as a viral infection, it causes a more severe form of inflammation. Finally, myocarditis, of course, has always been with us, and the rate is about 10 to 20 per 100,000 per annum. So that's the sort of rate that we'd expect to see in Jersey, usually.
And if someone has one of those conditions and they're worried, they should speak to their GP, ring the helpline?
If people develop chest pain, palpitations, shortness of breath, a few days after vaccination, they should certainly contact their GP or the vaccination centre, who will of course refer them on to an appropriate medical outlet.
Becky, there are, I'm sure there are still islanders who haven't yet had their first jab, and have may for whatever reason they either couldn't have it or they opted not to have it, but now they may have changed their mind. But can they still register in the same way that they could have done earlier in the year and sign up and begin the process of getting their 2 jabs and a third if needed?
Yeah, absolutely.
Right.
They can come forward, book online, and come and have their first vaccine. So that's absolutely fine. Yeah,
Fine.
And I'd encourage them to.
Absolutely. Okay. The Delta variant, how effective is the current Pfizer vaccination against it?
It retains significant efficacy against Delta. So the efficacy of the vaccine, the Pfizer vaccine, all the vaccines, against the Alpha variant, which was the variant that we saw over Christmas during the second wave, was higher against Alpha than against Delta. But it is still very effective against Delta, and the Pfizer efficacy against Delta is about 84% in terms of preventing infection. It then is about 96% against hospitalization and 98% against mortality.
So is this booster specifically against a variant or just general?
This is in general before the vaccine starts waning.
Okay.
So if about 2 to 4 weeks after vaccination, your protection is approximately 80% against infection, 96% against hospitalization, 98% against mortality, then over a period of months that will start to wane, particularly if you're over 50 or you have an at-risk underlying illness, which is why we want to boost it with a third dose, with a booster, at more than 6 months after the second vaccine, to take you back up again to where you started off, which will then tide you over winter.
Fine. And then what's the thinking then? That we will have all, as a community, built up enough resistance to COVID, or if another variant appears, we'll get another jab or another booster to tackle that?
Well, so with circulating virus, those who are vaccinated will get a boost to their immunity through natural exposure, and that will put them in a better position still. Obviously, people are undertaking population-wide studies to determine what's happening to people's immunity with time. So the same way as they looked at waning of immunity after the second dose, they will be looking at waning of immunity after the third dose with time. And part of that will be affected by any circulating virus in boosting immunity naturally, and on the basis of that make a decision about whether further boosters are needed or not. That decision awaits those studies, the outcome of those studies. The second part of your question was variants. So far, the vaccines that we've used have all been based on wild-type variant, which was the original one we saw in our first wave. Mm-hmm. And the vaccines developed against that have helped protect us against the Alpha variant and against the Delta variant. So with new variants, if the vaccines are good enough to continue to cover us, and our immunity, that the immunity we derive from them seems to be sort of modulated by natural exposure to infection, then all well and good, we will continue with those vaccines. If, however, vaccines require to be tweaked, then they will be tweaked, and people are working on accelerating the production of variant-based tweaked vaccines so that they can be produced and distributed quickly. So people are working on it, but at the moment there's no need to manufacture them and distribute them because we don't need to.
Okay, I mean this might be a bit of an unfair question,
Yeah.
but I mean, where do you see us in 5 years' time? Are we in and out for boosters, or do you think we might be getting one annual jab for it, or do you think COVID we could have fought it off completely?
I really can't answer that question because we're still learning about it, and what I think people are keeping an open mind on that. Therefore, aren't they? They're saying, let us just study what's happening with the infection, what it's doing in our general population. Let's study what's happening with immunity, and then on the basis of that, make a decision as we go along. And the more of that happens, the more we will be able to foretell what's going to happen further down the line. It's entirely possible that there will be an annual booster, but equally it's entirely possible that after 2 or 3 years we won't need any further boosters. We have to study it as we go along.
Of course. Right, thank you for that. Fascinating stuff. Yeah, so just another reminder about getting involved again. If you're just joining us now and you're watching live on Facebook, this is the Government of Jersey Facebook Live event, which is focusing on the winter vaccination programme. That's both the COVID booster jab, but also the annual flu vaccination programme. The two things are being brought together this year and being pushed out by the government starting in the next few days. In fact, some of the programmes are already open for certain age groups. If you want to get involved, please do so by hopping over to Slido, SLIDO, slido.com. Enter the hashtag 445566, which is the same as the helpline number. Post your question in there. Don't need to put your name in, don't need to download anything, and then it will pop up on the iPad in front of me. So, keeping the discussion going. Becky, I don't know whether this one might be for you. Obviously, we're getting a lot of medical questions, and I want to give Dr. Muscat a break. I can see he's finished his glass of water there as well, so you might need another. But why only one jab for kids aged 12 to 15 when the older age groups need two?
So the current advice is that we should be giving one dose for that 12 to 15-year-olds. So we're following that expert advice to provide that. So that's the JCVI advice and the CMO's advice in the UK, so we're continuing to follow that. That advice is under review, so if that advice changes, we'll then be re-inviting people in for their second dose. If you're a high-risk child and you're in the 12 to 15-year-old age group, the recommendation is that you do receive 2 doses. So we've done quite a few 12 to 15-year-olds who've been in that high-risk group so far as well. And so they have been receiving those 2 doses. I also forgot to mention earlier, so I hope you don't mind me saying, but around the flu vaccine, we still haven't received the flu vaccine yet.
Okay.
So we had some really good news this morning about the flu vaccine arrival. So we weren't expecting it for a few more weeks. So the date of the flu vaccine on Ireland is around the 8th of October. So just to re-clarify that, we don't have flu vaccine on the island just yet. And that mass flu vaccine campaign should arrive, as I say, on the 8th, and that should start on the 11th of October.
Okay, fantastic. Well, look, whilst I've got you, Becky, I mean, this might be, this is a bit of a tricky one here. Obviously, at the moment, we're just finishing summer. Lots of people have been able to have a break and have a holiday, and part of the, various countries got various rules about what you need to prove to class as fully vaccinated. Somebody's asked here, will I still be classed as fully vaccinated if I haven't had the booster? So I turn up on holiday at the airport, I hand over my certificate that shows I've had 2 jabs. Do I need to prove I've had the booster in order to be allowed in, or?
So, another good question again. At the moment, the policy decision is that fully vaccinated means 2 vaccines plus 2 weeks. So that policy position still remains in place. We are continuing to work with the UK as well as the EU to look at whether those policy changes take place. But at the moment, it's 2 vaccines plus the 2 weeks to be classed as fully vaccinated.
Fine. Excellent. Well, hopefully that's cleared that up, because I'm sure people will be thinking ahead for half term and going maybe over to the UK or visiting family elsewhere for Christmas.
Yeah, but the point of vaccination, though, is to make sure that you're protected against ill health.
Yes.
So whilst obviously that is an added value to you, we are promoting the vaccine. You have the vaccine to keep yourself safe.
Not to go on holiday.
Well, of course you can go on holiday.
Yeah.
But if you are going on holiday, it's really important that if you are in those at-risk groups, that you get the full immunity, because what you don't want to do is then fall unwell whilst you're away. So get your booster vaccine before you go away. That gives you the best possible protection while you're enjoying your winter holiday.
Excellent. Excellent advice. Ross, this might be one for you here. Somebody's messaging to say that her son is 17 and has had his first dose. When will he be called up for his second dose, or does he have to wait until he turns 18? What's the thinking there?
Yeah, so again, in line with the JCVI advice, for 16 and 17-year-olds, at the moment, it's only to receive 1 dose. And again, it's under review with their studies going on to see the effect of a second dose. So routinely, we're only offering 1. However, within that advice, it does offer the ability for 17-year-olds to have their second dose once they become 18. So yes, when a 17-year-old has or becomes 18 past their 18th birthday, they are eligible for a second dose in line with all other 18 and above.
Fine, thank you very much. Dr. Muscat, how many cases of blood spots appearing under the skin after having the vaccine have been recorded here in Jersey, if any?
I'm unaware of any thrombotic episodes in Jersey, but they certainly are a known and reported side effect of the AstraZeneca vaccine, and we do obviously keep an eye open for it. It must be said that there is a difference between this rare combination of drop in your platelet count whilst clotting, which is the specific side effect associated with AstraZeneca, albeit very rarely, and blood clots as a whole. Blood clots are very common indeed, and they do coincide with vaccination, even though they are not caused by vaccination. And that's an important general point, that many things that are common will continue to be common during the vaccination period. We're vaccinating to scale, and therefore some events will juxtapose or be adjacent to vaccination simply by chance. Mm-hmm. That does not mean to say that they are a side effect.
Okay. Thank you for that. Also, we've got a question here on the top of the list here. Which COVID vaccine is best for a young teen with a history of Guillain-Barré? What's that?
Pfizer. We're giving Pfizer to young people, and a history of Guillain-Barré does not contraindicate vaccination against COVID.
What is Guillain-Barré for those that don't know?
Apologies. It is a neurological condition, an inflammatory neurological condition seen as a reaction, as a form of allergic reaction to a certain event. Has been seen with various infections. It is seen with one or two types of vaccination, but a past history of Guillain-Barré does not preclude COVID vaccination, and Pfizer is what would be used in this instance.
Thank you. Becky, I think we touched on this earlier, but I can see some more questions coming in, so perhaps people are joining us part way through. Is the Pfizer booster safe for all those double jabbed with a different type of vaccine?
Yes. So
is the short answer.
So yes, they've looked at it. So there's been a large study that's looked at what's the best vaccine to receive. So they used combinations. Is it best to have the same vaccine, combinations of, and which were the best vaccines to have? And the result was that they should have an mRNA vaccine, which is Pfizer, if you can have it. If not, then we would be able to offer you AZ. But the recommendation is that you have Pfizer.
Dr. Muscat, is there anything else we could be doing to keep ourselves safe from COVID? You know, it is affecting people with underlying health conditions. Obviously, some of those they can't help, but perhaps some they might be able to. I think, keeping yourself fit and healthy, for instance, could that help you, or is COVID not like that?
I think it's always sensible to keep yourself fit and healthy. COVID isn't the only sort of threat or disease in the world. Heart disease, lung disease, all sorts of things are out there, and keeping yourself fit and healthy is good in relation to your overall function. So that's a given. In terms of keeping yourself healthy in relation to COVID, it's more of the same, I'm afraid. Vaccination is our best and biggest protection against COVID, and we really must avail ourselves of that opportunity to be vaccinated. We're lucky that we have such a vaccine available to us quite freely and quite straightforwardly. So avail ourselves of that, avail ourselves of flu vaccination. And I suppose if you are at risk, then trying to pursue Lower risk activities, that's less mixing, smaller crowds, open spaces, better ventilation, also puts you in a safer position.
Okay. I mean, somebody's making a point here that if you are vaccinated, if you've had your 2 jabs, you can still catch COVID and you can still pass it on in the same way that an unvaccinated person can. So why perhaps are we discriminating against the unvaccinated?
Mm-hmm. So if you're vaccinated, you have an 80% protection against catching the infection, which means that 80% of people who are vaccinated can't catch and transmit the virus. If you're not vaccinated, you have no protection against the virus. You've got a 100% chance of acquiring the virus and a 100% chance of transmitting the virus. So you are 5 times more risky to the general population because you're not vaccinated. Additionally, of course, from a personal protection point of view, if you are vaccinated, apart from not getting the infection, should you get the infection, you are going to have a less severe form of infection and a lower risk of being hospitalized and a lower risk of dying.
Okay. It's kind of sticking with that theme, but moving it on slightly. Somebody's asked here, and it's had quite a number of likes, do the panel have concerns on antibody-dependent enhancement? If not, why? So first of all, what do they mean by that question?
I'm not entirely sure what they mean by that question. What will happen when you get repeated exposure to the vaccine or to natural infection is that your immune system will simply get stronger and switch off the virus significantly. It does not mean that the immune response that you have will cause an adverse reaction. So if that's what they mean by it, then that's not going to happen.
Fine. All right, thank you very much. Ross, we've got a question in for you here about why aren't we giving vaccines in schools? Why aren't we for those children that are going to get them? Wouldn't it be easy to go out to the schools and give them there rather than elsewhere? What's the plan there?
Sure. Well, with this, it's been a really careful process to make sure that we get vaccination of children right, not only to protect the children themselves, but to making sure that parents are involved and it's a real family decision that they understand the vaccine and they go through that process together. And when we looked at the deployments to children, we did consider vaccination in schools, but actually, again, linked with constraints of the vaccine itself and how that can be deployed, but also the ability to have the parents involved in the process and there to talk through questions with the medical professional and have that conversation. We thought that actually the best place to do that was in the vaccination centre, where we've got all those medical professionals readily available, and we can offer it at a time where it's available for parents to attend with their children to have that conversation. We also linked in with why the vaccine's being offered to that group in the first place, to not disrupt their education. We didn't want to take over a school for a day and have these long conversations, and also the 15-minute waiting period post-vaccination to disrupt on the school day for the child's education, but also for the school and the wider organisation of the daily school day. So those things considered, we came to the conclusion that the best place to offer would be the vaccination centre.
And when you say constraints of the vaccines, you mean things like keeping it at a certain temperature and transportation and that sort of thing?
Yeah, absolutely. These vaccines, as I say, do have their cold chain constraints as they're known, and it's exactly that. It's keeping it at the right temperature. It's making sure that it only travels a certain amount of time, that it's diluted in a certain way, and those sorts of things put a lot of control measures that you need to put in place, and again, the best place to manage that is in a single location where possible.
Becky, you might know this. Somebody's asked here, when after contracting COVID, how long should they wait before the booster? Do you need to wait sort of 6 months after you've had COVID, or can you just come up and get the booster? Or
so no, there is a wait for that.
Mm-hmm.
So at the moment it's 2 weeks. Is that right? Have I got that right? 28 days.
28 days.
28 days, apologies. So we're saying 4 weeks after you've been tested positive or you've had your symptoms.
Fine, thank you very much. Dr. Muscat, as a diabetic person, when can I have my booster jab?
As soon as you are eligible for it. So if it's 6 months after your second jab, go for it.
Brilliant. So as long as that 6 month window's passed from the second jab, you get in there. Okay. Ross, I know that you touched on this earlier, but I'm just conscious that some people might be joining us. When, you might need to work this out as well as I asked the question, but somebody's asking about over 60s. When are they going to be available to apply to have their vaccination? I know you said it's going to be a weekly phasing. Have you got a date there you can pick out?
Yeah, so it might be helpful if I go through just all the dates again.
Absolutely.
So from next Monday, the 4th of October, we'll be opening to the at-risk groups and clinically extremely vulnerable. The following Monday to over 60s, so that's the 11th. And then the Monday after that, the over 50s. And then finally, the last Monday in October to adult carers and family members of the immunosuppressed. So once you reach that date, you'll be eligible for booking, but it's also essential that you've passed your 6 month interval from your second dose as well. So just because we're open to your age group doesn't necessarily mean you're eligible at the time. You do need to check that 6 month interval.
Fine. And presumably people can go to the website as well and check for dates and things like that.
Absolutely.
Excellent. So, Dr. Muscat, we've had a couple of questions here on immunocompromised people. So that is what? That's people who don't have an immune system, or their immune system is flawed because they're fighting something else at the moment?
It's if your immune system isn't quite up to scratch because of either disease or treatment.
Okay, so we've got a couple of people here asking about when they need actually 3 primary doses rather than 2, is that correct?
Yes.
And then, so how does that play into the, or what might be for you, Becky, how does that play into the booster?
Well, at the moment, we're saying that you need your 3rd co-primary dose because your response to the first 2 doses was not going to be as good as it would have been if you weren't immune compromised. What JCVI have not yet recommended upon is when the 4th dose for that group is due. So presumably what will be happening is that people will be measuring the immune response both in terms of antibody levels and vaccine efficacy in real life after the 3rd co-primary dose, and on the basis of that make a decision about when a 4th dose, a booster, is recommended for that group of people. For now, what is important is that they receive their 3rd co-primary booster now, 6 months after their first dose.
Okay.
The second dose, I should say.
Yeah.
It's interesting, if I may say so, that throughout this conversation, I've found myself coming back to saying we are looking at it to learn what we're going to do next, emphasizing, I suppose, that this is still a new situation for us. COVID is still a new problem, and we have to learn as we go along because there is nowhere else to learn from. So that is why some questions remain unanswered, but we know that these questions exist, and we are trying to answer them for tomorrow and the day after tomorrow.
So just to clarify, any questions that can't be answered, it's not because there's a conspiracy, it's not because you're trying to hide something, it's simply because you're still learning, you're still trying to understand.
We all are. We're all in that boat where some answers are not clear. We know we need to answer them. We are studying it to come up with that answer.
Well, I mean, this might be one of those questions where we need that answer. But I mean, somebody's asked here, what's their immunity having had COVID compared to the vaccine? So I think what this person's trying to get at is, are they safer? Are they at less risk because they've had full-blown COVID rather than perhaps someone standing next to them that's simply had the jabs? Or are they equally immune?
The duration of natural immunity or immunity from natural infection and from vaccine seems to be comparable, but the breadth of immunity that you get from natural infection is greater. because you are exposed to the whole virus, and therefore you develop immunity to all the bits and pieces of the virus, whereas the vaccine only provides you with a small number of antigens, and you only develop immunity to that small number of antigens. So it is, but the duration of protection against reinfection is approximately the same.
Fine. So whether you've had it or not, you should still be seeking to get your booster.
Absolutely,
Yeah.
absolutely. And if you get vaccinated on top of having had natural infection and therefore natural immunity, your immune response will be significantly souped up. And some have called it a sort of super hybrid immune response, because it combines both an amplification of the response as well as a broad response all at the same time. And such individuals may be able to fend off variants which have not been circulating, but which can be created in the test tube. All this is done in test tubes, and you can work it out. So get the booster. You're in a good position to be better off getting the booster.
Brilliant. So that's a clear message there. If you've had it, don't feel like, oh, well, I'm in a better position. Actually get it and be in...
better.
Even better.
Yeah.
Absolutely. Okay. Becky, Sherrington, nearly 80% of hospitalisations are purportedly obese, diabetic, smokers, or other types of cardiovascular complications. If I'm outside of these conditions, do I really need the vaccine?
Yes, there are certain high-risk groups, and some of those high-risk groups are noted there, so particularly diabetic. So even if you're not in the at-risk group based on your age, you are at risk because of your comorbidity or other illnesses or high-risk categories. So age is one of the highest predictors of mortality and hospitalisation. We also know that there are high-risk conditions that put you at higher risk as well. However, saying that, young people still get hospitalisations, and we also know that people in the younger age groups still also die as well. So, which is why we're in a really good position, that those over the age of 30, 89% have had their vaccine. So that message has been really taken on well by the island.
Dr. Muscat, I know that you've stated publicly already that you hope that we won't have to endure another lockdown this winter. Obviously, the vaccination programs help with that. But somebody's pointed out here that viruses mutate, as COVID already has. Are we likely to see the continuing or perhaps reintroduction of social distancing, masks, and that sort of thing, you know, as different strains of COVID emerge?
As always, this is all about a balance of risks, and that's the way we've approached the pandemic from the outset, and that's the only way we can continue to approach it going forward. We would very much like to avoid reintroducing mitigations, non-pharmaceutical interventions, because they are disruptive, they are restrictive. But if the threat from infection is such that we have to introduce some form of mitigation, then that is what we will need to do to ensure that the health service can cope, to ensure that people don't suffer unnecessary morbidity, let alone mortality. But the vaccination program has really changed the significance of COVID hugely, and we hope that as a result of that, we will be able to work our way through winter without abrogating reconnection.
Okay, thank you. Ross, just to briefly touch on something, we know that the booster programme at the moment is targeting the over 50s and those perhaps under 50 that need it or might be vulnerable. Is that the under 50s, is that because they've had their second jab quite recently, so they're still quite well protected against it, or is it simply because they don't require that level of protection at the moment?
So I think the JCVI, who offered the guidance of over 50s and those below who are at risk, considered all the different aspects of population groups and who's most vulnerable and who's not. And they came to the conclusion that at the time of, or the sort of time period that we're going in, the highest risk to people was for those over 50s groups and those under 50 who are more at risk. And they have said that those who are left out, so the under 50s who aren't at risk or a healthcare worker, they will consider in the new year to see if there is benefit to offering them a booster as well. But for us at the minute, we take the scientific expert advice of the JCVI, and their advice is for over 50s and the at-risk groups only.
And just for clarification, the JVCI are, or stands for?
So that's a Joint Committee on Vaccination and Immunisation, who are a panel of scientific experts who do everything to do with vaccination.
Is that a Jersey panel or a UK panel? Or?
Based in the UK, but we take their advice because we can't replicate the sort of expertise that they can from across the UK. I mean, collectively, they've got hundreds of years of experience in vaccination that they bring together to look at these sort of studies about vaccination and then offer the guidance to the health community in the UK and Crown dependencies, including us. So we really do look to them for their expert advice.
Thank you for that. Right, well, the time's upon us. So what I just want to do next, before going around the panel, really to gather your final thoughts. Dr. Muscat, last time we did this, there were a lot of questions came in from understandably concerned pregnant women, pregnant islanders who were worried about the implications of having a COVID jab, as it was back then, whilst pregnant. Somebody's asked here, and I suppose the question can be broadened anyway. Is there an increased risk in the first trimester if already vaccinated and I'm now eligible for a booster? Should they wait until after they've had the baby, or should they get, if they've had their jabs before they fell pregnant and now they are pregnant? What's the thinking now?
The general advice in the UK and the United States is that pregnant women should get vaccinated at the same time as women of their age who are not pregnant get vaccinated, get offered vaccination. So it is certainly very true to say that getting COVID in the third trimester carries a significant risk for both the mum and therefore the baby. So getting protected before you enter the third trimester is really important.
Okay, and we can see there the second part of the question. Do we know if there's any interaction with the flu jab?
No, not just because you're pregnant. No, there isn't. There
Fine.
isn't if you're not pregnant. There isn't if you are pregnant.
Fine, that's very clear. Thank you. Right, well, let's just go around the panel now as we finish up, and invite you to. I mean, Becky Sherrington, what's your? This is your chance to speak to islanders before we start this booster programme in its masses. What's your message to everyone who's watching at home this evening?
Well, I'd like to thank them for this evening, because the questions help us, enable us to make sure that we get our information given correct. So thank you for those questions. They're really useful. And I hope tonight has helped. And I would encourage people to come and get their booster as soon as those groups open, and also to get your flu vaccine.
And just to clarify, they can do that by either ringing the number 445566 or going to gov.je.
Yeah, that's right. Yeah.
Where they can register and fill out the form and apply for their slot to have their vaccination.
Yeah, very simply, go online, choose your date, choose your time, appointment will be sent to you, or phone the helpline.
Brilliant. Dr. Muscat, how about yourself? What would be your sort of thoughts as we enter this winter?
Twofold. I think I would reiterate what Becky said. This is a really helpful opportunity for bilateral communication, a point we discussed at the very beginning, in fact, of the meeting, of the talk, and an essential part of the teamwork. I do believe that the best way we can defend ourselves against COVID and influenza this coming season is to be vaccinated appropriately, and I would encourage people to get vaccinated as soon as they're eligible for that.
Thank you, Dr. Muscat. And Ross, obviously you've got quite a task ahead of managing the whole sort of programme and the machinery that's going to go on there to make sure everybody gets in on time and vaccinated. Is there anything anyone can do to help to make that job a bit easier, or anything they should be doing or shouldn't be doing?
I think, echoing the other panellists, just don't delay. We have put a lot of preparation into this. and we're ready to vaccinate and offer that booster and protection to the public. So use the portal, book your appointment through that as soon as you're able to. As I say, from the 4th of October, we'll be accepting medically high risk and clinically extremely vulnerable. From the 11th, 60s and over. From the 18th, 50 and over. And then from the 25th, adult carers and family members of the immunosuppressed. So as long as you fit into one of those groups on those dates and you've got your 6 months from your second dose, please do use the portal, book in as soon as you're able to do so, and we'll do the rest.
And when you say portal, that's the booking mechanism on the website?
Yeah, absolutely.
.j. Brilliant. Right, thank you for that, Ross. And thank you to the entire panel for giving up your evening to make this possible and answer the questions that we've been receiving from members of the public. I hope that the answers, even if we haven't got round to your question, we've touched on the subjects that you've been most concerned about and thinking about, or you may have read about, or your friends may have been talking about. We've put your mind at rest. If you still have questions, obviously that helpline is always there, 445556. The website is there for you available to you to go on and book your jabs, as the panellists tonight have been explaining how important that is. So what's left for me to do now is just thank all of the team behind the cameras who have made tonight possible. Thanks once again to the panellists sitting to my right, and most importantly, thank you to you at home for submitting all your questions. Don't forget that we've got a dedicated children and young persons vaccination question time, a similar event to this, where we hopefully might even have some youngsters in the audience to ask some questions themselves. That's coming up in the next couple of weeks. But until then, stay safe. Thank you very much and good evening.